My career in healthcare started, uh, well, because I wanted to be a doctor. And initially, in India, we had to write competitive exams. And these exams were based on criteria. You either become a doctor and then you become a dentist, and it goes on with the scoring points that you get. So my score was not adequate enough to go into med school. So my score was low. So I got into nursing school, and I graduated from a reputed institution from India, which is Trivandrum Medical College in South India, Kerala. I graduated in '99, and I had a passion for nursing. I developed a passion for nursing throughout my career, throughout my study period, when I did my course. And unfortunately, I lost my brother the same year as I graduated in a tragic accident. And that actually turned my life as well. And I wanted to do, I was more passionate and became passionate about my care in nursing. So I used to teach the nursing students in India, and I moved to the UK in 2004. Did get help from my in-law uncle, who was a consultant here, and that's how I got my adaptation. My hopes, my expectations was I could study as well as work. So I could do it in, like while working, I could graduate, I could do more, which I always wanted to do in my career. I was always passionate about educating myself and learning, and I never stopped to learn. So that actually was the passion for me to leave my family in India and come here. So I came here, and ever since I came here in 2004, I was always doing some courses. Always, even though I had a family, young family, I was passionate and wanted to get back into teaching, and that's how I used to be an ICU nurse in the intensive care unit in a reputed hospital in Yorkshire. I had my adaptation in a nursing home, which was not what I expected actually when I came here. So it was a nursing home, and I thought, although I was passionate about the care which I gave, I thought my career was not getting anywhere because I always wanted to learn. So my adaptation process was only 3 months, and I got my PIN number very easily because I got my documents signed off, and I got my PIN number within a couple of months. And but because I thought, although my aspect was there, but there was no progress up the ladder for me there. So I thought I had to move to the hospital scenario. For progression up the ladder was quite difficult, and I think majority of the thing was it's you either be a band 5 nurse there, that was all, or you can't do any education or any um, like improvement in your career because it was nursing home and the basic cares was the only thing that was given. So I needed to be in a specialty place and or unit. So I took my career when I got this job in the intensive care unit, and I worked there for 10 years. But then also I knew that I was not going to get anywhere. What it was like in intensive care, we had lots and lots of barriers. And I felt, although I was passionate about learning and development, I was not given the opportunity to progress or even apply for a role which I wanted to, because of the fact that I would say the others were given the opportunity, but not me or my other colleagues from overseas. So that was the reason why I stayed in ICU for 10 years, only because of family commitments. My children were young, and I had to do the rota according to my husband's work pattern as well. So I was working predominantly nights and weekends, which I didn't like to. I never was a night person. I never used to like working nights when I was a student as well. So I was forced to do it because of my family commitments. In the ICU, we were not tread fair. I always used to speak up, and that was why I was in a very difficult situation every time. So I was we we were always, if we had a small, like if we made a small mistake, even, not signing the charts, even, it was taken up further, and we were taken up into, disciplinary actions were imposed to the migrant nurses, I would say, then. And if it was the other nurses, it would have not been treated the same way. So I had faced, I wouldn't say we, I would say I had faced a lot of issues while I was working in the particular institution where I was. And and because we had no family to support and no one, here to, go and express ourselves when I had a problem, I felt it very overwhelmed by it, and I felt I would lose my career at one point as well. But that was not a major issue. I didn't do anything. My care to the patient was not in danger. And I always believe that I always practice safe care. But this disciplinary procedure which I went through was really, I would say, it caused a massive change in my career, as well as I lost my confidence even. One of the senior nurses came to me and said I couldn't wear 2 earrings in ICU because it was against the infection control policy. But this particular nurse had always been behind me, and she even asked me to take my. In India, we have a custom of wearing our marriage chains, which is a symbol of our wedding vows. As in England, we have the wedding rings. So she even came and asked me in the beginning itself to take that off because she was the infection control nurse, and she asked me to take it off. And I said, yes, I would take it off. So I discussed it with my husband, and he said, if it's more priority, I don't mind you taking it off for your work purpose. And we know we are married, and we know what it is in our belief. So you don't have to prove it to anyone. So I discussed it with him, and I took it off. Then she was always on my back. I knew that. And I had 2 earrings. I wore my upper ear, and I had 2 earrings. And that was the reason. That was the main issue. She actually asked me to take it off, and I said, I just wore it now. I can't do it, but I will do it later. But because I didn't take it off that day when she asked me to, she was behind me, and she pulled me up on my documentation, which was a silly documentation error, which I did, but it was not major. And then also another issue, because she had to make statements on different occasion in order to put a complaint against me. So she did that to me, and I would say that actually I didn't have a life for a month because I was not I didn't know what I was taken for my actions. So the manager came to me and said, you are under disciplinary procedure and you can't work. You have to be supervised. So I said, what did I do wrong? Your patient care is not affected. You can work, but if you want to go off sick, you can go off sick. So he said, I don't want to go off sick unless I know what is the reason. We can't tell you the reason. So I was not told what my actions or what I did wrong was until I was taken into the panel. So she said I could take my representative with me, and I went with my representative. It was after a month after she said, I went with my representative, and only then did I know what it was. And immediately when I knew what my action, what it was, I knew who this person was. And I think if it was another English colleague or white colleague, it wouldn't have been taken up. They treat their own colleagues very differently to us. That is what I found in the place I worked, not anywhere, but yes. So I knew from that time, that was in 2010, I wouldn't be able to work there and I wouldn't be able to progress. So this disciplinary action favored for me. It didn't favor against me. So the outcome was all like I could work still because I didn't do any harm. I didn't kill a patient, although it's an intensive care unit. I didn't kill a patient, but that knocked my self-confidence off really, really badly. And I then decided I have to do something different. And I did research for 6 months, which I knew I wouldn't get. Which I knew I wouldn't get a permanent research job. I went for at least 10 interviews before I got this research secondment job for 6 months. It was a maternity cover. Because of the discrimination in the place, we won't get any. And I have been to many people. I went to see many people and asked, where my problem? I can speak good English. I can communicate well. So what is it I'm lacking? And they wouldn't say. Maybe you're not answering the questions up to their mark. But still, I can get interviews, calls from all over the country, but not in my place. I can't progress. So why? Why is there this a restriction for me? Because I've done courses, I've done everything to progress up the ladder, I've got the experience, but people who come after me are in band 7 position. How come that I am struggling? I have been a nurse for over 14, 15 years when I applied, and still I couldn't progress. But newly qualified English nurses would be, within 2 or 3 years, they will be band 7s. So how come that happens? I asked. So I was not able to question. I wouldn't get a feedback even. A feedback would be, whenever I asked for a feedback, would be, you did well, but someone else did better than you. That was the feedback I would get by email even. So there was no way for me to improve myself as well. Or, even I used to do my job, which was going for informal visits. I used to go and, make myself familiar before I went for the interview. But still, it was not working. And my husband said, why don't you try nationally and see how it works? My husband was supportive, I would say. Yeah. And I had a young family, so it was not like my children were old as well to talk to them about it as well. But I was so defeated and I felt like because I was teaching nursing, I was teaching the students back home, and for me to be in that kind of a position, it was really, I think it was more like, where did I fail? What did I do wrong? Like, why this has to be taken into such a position, which I could have actually talked to that person and it could have been resolved. I was ridiculed by other members of staff. Why are you under supervision? Why do you have to? You've been working here for long. Why are you under supervision? It was like after I joined and after 4 years of being in ICU, I was picked up by this particular person. And that actually, you know how it'll be. They said they would refer me to occupational health and give me counseling, but I didn't go for that route. I said I was a strong person because I had lost my brother, that will nothing will break my heart than that. So I was determined I wouldn't take time off sick. I was determined that I would continue in the same place. And even after the disciplinary procedure, people asked me to leave. They said, go find another job. Why are you here? But I carried on because I want to prove myself that I can work. I can lift my head and walk over the people who did that to me. So I worked there. I worked there. And then I chose to leave. Yes, I chose to leave the department because I wanted to progress in my career. And I chose to leave and I went. But research was not my cup of tea. I always had a passion for teaching. I was working in outpatients department. So all our services were stopped because of the pandemic. But I used to still work like bank shifts because I liked ICU. I didn't want to lose my ICU skills, being not working there for long. So I used to keep in touch, like go and work there on the bank. So I volunteered to work there during the pandemic. And it was I would say it was a rewarding experience for me. And I had written a reflection on what I felt like while I was working there during the pandemic. And it was a different environment totally. It was not the ICU that I worked before. We were given training. We were given lots of training on how to deal with the pandemic because it was the first wave, and we were not knowing what to expect. It was like going to a battlefield, I would say, and just walking without knowing what you're going to do, or if your mask goes down, what will happen? Will you get it? Will you be taking the virus home? Will you die? That and not knowing what to anticipate was really distressing. But during the period when we had the trainings, like we call it the supernumerary period, we had lots of colleagues coming from different departments, and they couldn't face it because while the doctor was explaining how to assist the consultants for intubation, he said, there's no emergency in a pandemic, and that is what actually struck me. And we have to look after our colleagues, and we have to be there for each other, helping each other. That was brilliant, and we all worked together as a team. And the worst or the or the thing that broke my heart was the patients had no family to be there when they passed away. They couldn't hold their hands, and we were the only ones who could hold their hands, and console them or be with them. Well, consoling, I don't know whether they would know because they were all intubated and under sedation. But it was really heartbreaking for the families, for us to see that, and for the poor dying patients as well, which was really traumatic for me. At one point, I didn't want to come home. So during the first wave, we were offered hospital accommodation or other accommodation where we could stay. And I stayed in the hospital accommodation to protect my family, actually. My husband is also a medical profession, in the profession, but he is in a less dangerous place than I was. So, and because he had underlying health issues, and my daughter as well, I chose to stay in the hospital accommodation, which was really heartbreaking for me as well. During the time of pandemic, you want to be near your family, but I coped as well, and I thought about all the other dying patients, and that was actually what motivated me to carry on and listening to my spiritual songs, and that was my diversion actually. And the online press and masses that we had during the pandemic was really a big relief for me, because I'm a firm believer. So that is how I coped. And even when I moved to a new job, which was entirely non-clinical, but during the second wave, I volunteered again, and I said I would go and work on the intensive care unit in the other hospital as well. And it was also but it was a less challenging situation than the previous one, I would say. So I coped well with that, and we all worked together as a team. And it is nice when you walk down the corridor, you see someone from the ICU, and they say, "Hello, how are you?" Because we still have that closeness. Even the physiotherapists, the doctors, the everyone who worked there, the housekeeper, the domestic people, everyone was so brilliant, I would say. We all worked together as a team. Yeah. Fortunately, in the ICU, we never had a shortage of any PPE. Where I worked, both the hospitals, I would say. Um, but the PP, wearing the PP was really the the horrible thing for any healthcare workers. So, but we got adequate rest, and we were very well looked after. I should say, I know there were many trusts who had shortages, but in our hospitals we never had shortages of any PPE or anything. Yeah. During the first wave, our emotions were like we didn't know was what even the pandemic was, because we had Ebola cases, we had the SARS virus before in the past, but this was something which the media and what happened in China was made us feel that going to work, we won't be coming back. Many of our colleagues and even I actually thought about writing the will, and we wouldn't see another year like that. So it was quite a daunting feeling, I would say. Even going to work was, I would say, I would kiss my children and make sure that I would think that that would be my last kiss, or even I may go back. And we used to discuss about if we were coming as patients here, kindly treat us like this way. Don't be too harsh on us. I wouldn't want to be tubed for long like that. We used to discuss things like that. So even the whole medical profession as well, even my colleagues, some of them didn't choose to go to work. They said they'd rather be taking sick leave and sitting at home rather than go and face this pandemic, because they were that worried and anxious about how it would have an effect. So I know, because it was major effect was because the majority of the people who were working for the NHS, majority of the BAME community had got it worse, and many of the doctors, nurses were not recovering fast as the others were. So I do know a few of my overseas nurses and families who chose not to go to work actually during the pandemic. But we both, my husband and I, decided that we can't do that. And although we have underlying health conditions and other things, we we decided we had to go to work, and we were both working during the pandemic, and even now, all through the pandemic, I should say, and even now. I would say the compassion and the feeling that you can sit at home, but what would you get? You would only worry about what's going on in the world. But if you go there, you are helping somebody, you are doing what you can for the NHS. And even if you get it, you are you are deemed to get it anyway. You can go to the supermarket and get it, or you can go anywhere else and get it. But when you're doing your job, it is your, I think it's your call, something which comes from the heart. And I think I am a firm believer that I have not taken lot of sick time off when while I was at work, or even now. So I still believe that if you have a duty of call, you have to do that. And it comes from your heart. When the world is facing a pandemic, you have to be there to help the others. So that's what I think. Both me and my husband are strong believers of that. So although he lost his colleague who worked with him, he didn't be without going to work, So it was quite stressful, I would say. And even my family back in India were asking me, why do you have to go and work in ICU? It's a very intense area, and there's more chance of you getting ill than you being in a less, I could work in my outpatients department. I could have worked there. But I thought, while my colleagues are struggling there, what will I gain in being at work and, having a easy day? It's an easy day in outpatients where we can, patients are not coming, so we just have to stock up and do other admin work, and we could go home. But I thought that was not my. I didn't think that I would have a conscience working like that. My conscience wouldn't let me do that. During the first wave, no treatment was working, and it was so distressing to see the patients who just get admitted deteriorate in a couple of days' time. And you would be talking to them and saying you would recover. Young, old, middle-aged, all dying in a couple of, like weeks' time. But the rewarding thing of being an ICU nurse was I could always say that I was proud to be an ICU nurse because I could see them recover and go. But during the pandemic, I couldn't see that, and it was so disturbing. And every time when we go, we had seen patients who were admitted less than 2 weeks' time pass away. That was quite disturbing. And as I said to you, with no one, and they wouldn't even be, when they come, they wouldn't even be thinking that they would end up dying. That was really traumatic, for me. Because I remember a man who was not old. He was only 55, and before he tubed, he was asking, "Will I be able to go back?" This pandemic is like, so we can talk to them. So although our PPE is very, very restricted, they can't hear us really well. So we had to, like, the touching and the, consoling was like through touch. And we had to shout as well. So it was really difficult, but we were trying our best to console him. And then when he was tubed, he knew he was not going to get out. But that was the last moments. He couldn't be near his wife. We couldn't even ring because at that time, hospital put a restriction to visitors. Families couldn't come. They only were allowed to make phone calls. And even that was a barrier for us because we had to shout and they wouldn't hear what we were talking because of the PPE. So it was quite distressing, I would say. And the worst thing is, like, I haven't seen patients die like that. So that was really horrible, I would say. Yeah. I think ICU is a very safe place because there are other places in the hospital, like the A&E department is not very safe because you don't know what's coming through the door. So I think they had difficulty with the PP and stuff like that. But ICU, we know we are getting patients who are COVID positive, and patients who come to us are already, critically ill, and they are already diagnosed. So I had no issues feeling that I was not safe, because even when I went volunteered, my manager made sure that I had the right PPE. My I was fit tested and given the proper mask, respiratory mask, as well as she always used to insist that the BAME community had their blood test done for antibody. So we had the antibody testing done while we were there. And also, she made sure that we had lots of supplies of PPE as well. I had a risk assessment, and it was like a COVID age. So my COVID age was all right, because although I am from the BAME community, I have no underlying health conditions. So my COVID age was not as high as my husband's was. So we had risk assessment done, and we were told on, like we had counseling, and we had groups like BAME community groups and networks, which discussed about getting, what to do and how to protect ourselves and things like that. There were support groups for us during the pandemic. I wouldn't say that we didn't have support groups. Yes. It did cause anxiety among the family, like my husband and myself, because he lost his colleague who was a BAME member as well. So it did cause a bit of anxiety, but it didn't stop me from not going to work. It didn't stop me from not caring for patients, or saying that I need to go back, even, to my base, which was outpatients department. I still continued to work there, and it was difficult, but I thought there was no need for me to go back. And even I completed my last day working for the trust in ICU, because that's where I started, and I wanted to make sure that I did a bank shift and ended my career there. So, ended my career in that trust there. That's what I meant, yeah. The clapping really, really was so cheerful, I would say. It made me, during my long hours in ICU, I initially, when I used to stay there, I didn't hear the clapping in the hospital accommodation. But when I used to come home, it used to really be like rain in the desert for me, because it was so nice to see the public, general public, coming out at 8. That's when we come out as well. Come out and clap their hands for the NHS workers. That was really, and for the key workers who worked. Not only us. During the pandemic, many people were working. So the shopping shops, the people who worked on the shop floor and everywhere. So I think that was really good. Yeah. And it used to cheer me, really. Yeah. The overall impact of the pandemic on me, I think it has made me realize that um, there's nothing that we can do together as a team, and no viruses can take, the teamwork and the team spirit that we had during the pandemic. And I really cherish all the times that um, I had spent and volunteered when I worked in ICU. I'd really thank everyone whom I worked with, because everyone, all the workers, all the all the goodies that we had during the pandemic. We had lots of donations in ICU. We had loads of food, loads of stuff given to us, even toiletries, because we had to have showers before we left the ICU. So all those goodies, everything was, overwhelming for all the staff who worked there, and it was a real experience for me, and it's once in a lifetime experience, right? I think the pandemic will go on like another year or two, but what we experienced will always be in our heart forever. And it has made me realize that life is more valuable than anything else. Yeah. And I'm glad to be here, alive. Yeah. The relationships that I had previously, and when I came back as well, the person who complained against me was working, and it didn't alter my communication with her. I had to hand over the patient at times to her. It didn't. Um, she did thank me for what I did, actually. Oh, you have come back here to help us out, so she said that. But I would smile at her, but I wouldn't go into a deep conversation, like, talk to her. But I knew she lost her mother, and I spoke to her about it. I didn't show any grudges to anyone. I am not that kind of a person who keep my grudge. So I did have a good relationship. And on my last day, when I worked there in ICU as well, I handed the patient over to her. So, but the impact it had on me, the whatever she complained, I wouldn't forget that. I can forgive her, but not forget that moments that I had without a life. I used to shut myself in a room. So that was really a horrible experience for me, I would say, than the pandemic even. Yeah. I always wanted to get into teaching, and this is the teaching job that I got. And when I talk about it, it's a fixed term contract that I went for, but I am so happy that I enjoy what I'm doing. I am an international nurse, and the position which I've taken now is I'm the OSCE trainer for the international nurses who come, like me, to a strange place. I am with them. I'm with them, being a pastoral care for them, doing the pastoral care for them, doing everything for them, being their like a big sister to them. So that's what, and telling them about how I felt many years ago in the same place as they are. So I think that's the kind of job that I want to do. So, and also teaching them and preparing them for the OSCE. So we have them for the 3 weeks, and we train them for the OSCE, which is conducted by the NMC. And once they complete the OSCE, they go to the ward and they get a PIN number and do the jobs as a nurse. So it's quite rewarding because the feedback I got from the first cohort was so uh, overwhelming for me that I nearly cried, because they said, when we came to the UK the first day, when we stepped out of the coach, we saw you, and you wouldn't know. They all from India, the same place as I am, South India, Kerala. And they said when they saw my face, they were so happy that they could talk to someone in their language and communicate. And because when they come from India, they said they can't understand what our team leader was saying and things like that. And I could like tell them what it was all about and explain to them in a simpler way and tell them how to protect themselves. And I think they took on board everything that I told them as a big sister. So so I'm happy that I'm able to do something good for someone. I am proud to be a nurse, and although I'm passionate about teaching, I am still an ICU nurse. And if you're an ICU nurse, you're always an ICU nurse. And I miss my ICU, being an ICU nurse, because that is what is. I really enjoy being in ICU situation where it is quite stressful, but the stress brings a lot of reward. Especially when I was working in the post-op care unit. We used to see patients coming after open heart surgeries and recover and go. That was a fruitful thing for me, and I always cherish those moments which I had. So yes, I would say ICU, being an ICU nurse has always been a reward for me. The previous trust where I worked, we had no opportunities. The there was no like support for the BAME people was very very. I would say very very. I would say there was no support at all for the BAME people, and even progressing up the ladder, I had to go and find my coach. Whereas I had to pay and go for a coaching session only because I wanted to develop my interview skills. There was no support, like even if I knocked on many doors asking for help, support was not given to me. And I nobody came to me and said, I can see you progressing up. Do you want to do this course? Nobody came and offered a course for me. Whereas in this trust, when I came, they were just asking me to do that course, this course, like you can be a mental health aid, first aider. You can do this. You have compassionate for teaching. You can do this course. We will put you on the NMC OSCE Train the Trainer course. This was all offered to me within a space of 4 months, or even 2 months even. So I feel that they come and ask you to do these, but I never got that opportunity. I wanted to learn. I went for funding, and they said, if you don't have the money, don't do it. That was what my manager told me. She wouldn't support me, but she said these words to me. My matron said these words to me. If you don't have the money, don't do it, Rosetta. So that actually made me take it as a challenge. And when I said it to my husband, he said, even if you have to spend £5,000, you have to do that course. And I did it, and I passed it. So that little things, if you ask for any courses, you are given a no, whereas your other English colleagues who have been there for less than a year get the opportunity to do that. So that shouldn't be the case, And I want to voice it because I'm not there. I want to voice it for the people who are there and who wants to develop. There are people who want to develop and go up the ladder, who have been here for less time than me, who wants to progress. That shouldn't be a bar for them to progress up the ladder. I want to see all my junior recruits from India progress and doing well in their career, who wants to learn. Those who don't want to learn can have the opportunity to stay in the band 5 level and be whatever they want to. But why don't you give the opportunity for those who want to learn and progress up their career, Because I would say this, because my colleague who did the same training in India with me, my classmate, he is a band 8 now. He came here in 2000 and he works in a different place. But if he could do that, I could be the same position. I have the same abilities and qualification as he had. He did many courses which was supported. He was given all the support. He did not even spend a penny and do any course because he was supported. He was given the opportunity to learn by his colleagues, and his managers supported him. But I didn't get the opportunity. So I had to leave a place in order to progress and succeed in my career.